Hey there, everyone. My name is Billy Hatton, and I will be discussing myofascial flossing today. So, the definition is stated right there of myofascial flossing or tissue flossing. It's basically a compression technique. So, taking a band, wrapping it around either a joint or an actual muscle area, and letting that band apply compression. So, usually you wrap the band around so that it's 1.5 times its length, its resting length, and that'll be able to apply good compression to the area that it's applied to. And with that compression, you can manipulate skin, the muscles underneath, um, tendons, joint structures, and really get the compressive effects as you move and stretch and shorten and lengthen the muscle groups and tendons underneath there. So the purpose of it all, it increases mobility and joint range of motion, which subsequently has an effect on increased athletic performance and better balancing on a force couple of muscle pairs. And then there's also quite a bit of research going into how it can reduce pain. So it was first recognized in 2013 as kind of the first signs of it, and it really kind of showed up in the CrossFit world. And so from 2013, when it got kind of popularized there, it just kind of promulgated and just or propagated and just kind of grew from there with the CrossFit community. And from that point, there's been a solid 10 years of people starting to look into the research and get a better body of evidence for this technique. Uh, so the why of why people would do myofascial flossing. So even though it is a new technique and the research and evidence is still not quite conclusive and concrete on the positive impacts, there are some impacts shown in studies that athletes would care about. So the enhanced performance, again from maybe reducing the tension in overactive muscles through the compressive technique of myofascial flossing. And then there's also quite a bit about reduced DOMs after training. Athletes train hard, they get sore. This could help them avoid that. And then just for the general population, improve mobility and reduce pain from, it says tendinopathy, but any other like physical ailments is always a beneficial thing. All right, everyone, I'm having some issues getting the video to play, unfortunately. So I'll just kind of talk through what he's got going on. So first we'll hit common errors. One thing that I think is super easy for people to do, especially as they're new, is applying the band too tightly or too loosely. You get too much compression, get some numbness and tingling, and that's a sure sign to stop. You do not want that. If there's tingling, numbness, anything like that, stop the technique right away. Either reapply looser, or just stop. And then if it's too loose, the compression's not going to work as well. Another possible error is incorrect band placement. So just putting the band kind of in the wrong spot. You want it to work on a muscle, but put it on a joint, vice versa. And then discontinuous movement. So should always be moving the muscle group. The muscle group should be um, lengthening and shortening while the compression is on it continually. So for that like 2 to 6 minute window, you want to be moving those muscles. So any type of stopping is going to be counteractive or just not as productive as uh, the technique should be. So to demonstrate techniques, unfortunately the video is not showing, but you can see in the thumbnail of the video, he's got the band wrapped around the elbow joint, so he's working on that elbow joint. So the first thing that he does is he does direct application of rotation and pressure on the band. So if I had the band on my elbow, he's actually applying pressure to that band and helping to like rotate and kind of twist it on the area that it's applied to. And the second is flexion and extension. So in the video, he is just extending, flexing that arm back and forth. Again, it's the movement. He has it specifically on the joint, but it's the movement and the compression acting on length and shortening. And then the last is indirect application. So he's got the band here on the elbow, and he's doing a little bit of manual twisting and rotating and pressure up here on the wrist, and it's helping to move the joint and continue to like rotate the joint underneath that compression. So I call that indirect application of the rotation and pressure. And then some common exercises that can be done in the corresponding muscle groups that you'll see as push-ups or arm curls, as I was doing before. So basically looking at wrapping the elbow, or the shoulder, getting some compression on those joints. Squats, very common for quads and hamstrings to be wrapped up and compressed, and do some squats for 2 minutes. And then calf raises, get the gastrocnemius and the shin area all wrapped up, and then do some calf raises, or even just stretching the calf, getting some shortening and lengthening while under that compression again. All right, I went pretty long on the first two slides, so we'll try to speed through these last three. So for actual prescription of myofascial flossing, looking at an intensity that's the band should be about 1.5 lengths of its resting length when it gets wrapped around, and that's how much pressure you should be looking for. Through the progression you can see there as well, you can also progress kind of the pressure to a little bit more. The evidence shows that above 200 is usually where you start getting that numbness, and that's where you want to call it. Volume, just do one set. You do a rep range of 10 to 30 repetitions. What you're really looking for though is the time, be actively moving with the compression for about 2 to 6 minutes. Again with our progression, and start around that 2-minute mark, and then try to extend over weeks in time into longer periods of time. Frequency is pretty dependent on how you're going to employ it. So there's no current evidence that I could find that daily use is problematic. So you can definitely use it anytime before exercise, and then after exercise, it can be used sometimes for that DOMS effect or that anti-DOMS effect. And then finally, timing. You definitely want to do it within 60 minutes of starting the exercise. That's where kind of the effects have been shown to impact up to 60 minutes after intervention. In terms of corrective exercise, the myofascial flossing really fits in the inhibition phase, and the textbook even goes into it a little bit. There's a lot of interchangeability, as a few studies have shown that with self-myofascial rolling and IA-STM, and basically one can probably do the same thing as the other is what they're saying with that. So those are two inhibition techniques we know. That means that our myofascial flossing is going to likely fit in that category as well. And that's kind of what the physiology behind it shows as well. All right, so for the evidence, the actual research and articles behind it, the research is really, again, pretty nascent on this topic. So there's been some research that shows positive impacts, but then there's also some research that kind of shows equivocal results. So just need more time and more research going into this to really have concrete conclusions about what positive impacts are associated with myofascial flossing. So I gave two categories here that are pretty relevant to corrective exercise. So the first is that acute application shows improvements in muscle flexibility and range of motion. So specifically, we're looking at that from the corrective exercise lens towards overactive muscles and the inhibition of those. So there are two studies kind of looked at in that specific area. The first is the first showed that there is increase in flexibility of the quadriceps and hamstrings muscles with a myofascial flossing intervention. Force output and dynamic balance were also affected, but they're kind of secondary. The significance was lower for those outcomes. And then that same study also showed improvement in knee flexion and extension range of motion after 2 to 5 minutes of myofascial flossing of the thigh for the trials that they did. And then a different study showed that myofascial flossing of the ankle and calf, they used adolescent males. It had a significant impact on the H reflex of the soleus, but there was no significant corresponding change in actual ankle flexibility or plantar flexion strength. And then for the other category, we have enhanced recovery from pain or injury. So this is again relevant to corrective exercise if there's tendinopathy going on or some type of pain or injury. If myofascial flossing can be beneficial, we want to use it. So there's one case study of a 14-year-old female, and she went through 6 weeks of physiotherapy for chronic Achilles tendinopathy. Didn't see any improvement in pain. And then, the study says that it's 2 sessions of myofascial flossing. She drastically improved on the pain scale and was able to return to sport, actually. And then a different study is an actual research study showed that there was no significant difference between myofascial flossing and control groups for conducting physiotherapy sessions for their shoulder pain. So just 2 different areas that are important to corrective exercise and kind of how the research is not conclusive really one way or the other. Definitely more research showing positive impacts, but again, a lot of equivocal results out there and just needing more time to kind of sort through that. For certification resources or kind of where you can go to learn, there's no like national sport body or recognized sport body that really does a certification for myofascial flossing. So you're not going to find it through NSCA or NASM. But there are a lot of independent parties out there that have their own courses that will provide some type of certificate. So you get them through websites such as Udemy, and there are other popular ones too, the Floss, Allied Health Education. Those are just a few of kind of what's out there. A lot of them are combined with other courses, so like Massage World, the massage therapy world. A lot of them have combined course, or it's just a part of that course. If they're for these certificate courses that are specifically focused on myofascial flossing, the typical course length is 8 to 10 hours of instruction, and some of them are virtual. Most are actually in person. And then what the courses actually cover, they go over an overview of how it works, go over the benefits and the claimed benefits and claimed effects, and then a lot of them give a broad like kind of overview again of the human body and some of the key muscles that they may be interacting with during the course, and just that myofascial flossing is tend to be used on. And then they will go into the precise techniques of this is exactly how you wrap the band. This is what types of exercises to do with this band wrapped around. So that's that. It's just a references slide, so references that are specifically shown and discussed on the evidence slide, and then one that I used for a lot of background and application for the rest of the information.